most appealing thing about working at Weill Cornell Medicine is actually being supported by every single person who's working here. They all have one mission, and that's to provide outstanding care to our patients. Everyone makes sure that the patient feels comfortable and is safe, and also is understanding of what's going on in the process. Patients should always go to their primary care doctor at least once a year, at least for their annual wellness visit, just because at that visit they can go over important things like the current medications that they're taking, what conditions they have, ask if the conditions are stable or if there's any acute worsening, and then also go over healthcare maintenance, things like vaccinations and cancer screenings. But at the same time, patients should go to their primary care physician if they have any new acute complaints. Most commonly, we do see a lot of cold and cough, especially in the winter season. And then for other visits in terms of chronic disease management, we do see a lot of high blood pressure, diabetes, asthma, and we just make sure that the patient's symptoms are stable and making sure that they're up to date with their management. Primary care physicians have to really have the long game in mind. They have to really understand what their patients' goals are with their health. I am usually what I call their quarterback in the healthcare system, because the healthcare system is very complex. And I want to make sure that my patients are able to really understand what's going on with their health in all facets, whether that be nutrition, whether that be chronic disease management, whether that be speaking to their specialists about the various ailments that they may have. The great thing about working at Weill Cornell Medicine is that when I put in a referral to see a specialist, I can actually see the progress note that the specialist makes. And I can see what the specialist thinks is going on, what the treatment options are. And I'm really happy to be able to work with them because they provide world-class care. So it's really a lot of collaboration. And it's important for me to have these relationships with the specialist because it provides better patient care. I think the most important thing is that the physician really learns from the patient because we're able to learn from them the most. Different diseases may present differently in different people, and it's important for us to really speak to the patient, get to know what their story is, try and figure out a diagnosis plan, and create a management plan. One of the most important things I can do for my patients is educate them about their condition. What that means is that when they step in, I listen to them intently, make sure that they're heard for, and I want to make sure that my patients are able to really understand what's going on with their health in all facets. And I just feel like that relationship is something to be cherished and something to be really truly valued.